Good morning. This is Dr. Thomas Bartell, board certified plastic surgeon, specializing in body recontouring surgery. I welcome you to our weekly Friday morning Facebook Live broadcast. And today I'd like to talk a little bit about some aspects of how to select a plastic surgeon. Specifically, to identify several red flags that you should know about when it's not a good idea to go with that particular plastic surgeon. For instance, if the surgeon that you go to cannot show you multiple before and after pictures of his own or her own previous patients, there's a problem there. They ought to be able to show you examples of their work. If you were to buy a car, you're not going to buy it sight unseen. If you're going to even hire a plumber, you're going to want some recommendations, some references. Before and after photos really help in identifying what type of work that particular surgeon does. And if they can't show you examples of their work, or they have excuses on why they can't, patient confidentiality or so forth, that's a bunch of nonsense. They ought to be able to show you examples of before and after pictures of the specific procedure that you're interested in. If they can't, there's a problem. And along those same lines, they ought to be able to show you, to identify exactly how many of these procedures that they have done in the past, say 12 months. If they are a real part-timer, they'll say, I've done 4 or 5 of these, in the past 12 months. Well, okay, but for instance, in our practice, if you're interested in breast augmentation, I do 120, 140 of these every year, and I have for years and years and years. I am well experienced. I don't have a wide variety of procedures that I do, but the procedures that I do perform, I do a lot of. So you really want to go to someone who has a lot of experience, years of experience, and is well practiced in the specific procedure that you're interested in. A surgeon who doesn't really listen well to your concerns, doesn't ask you what it is you're trying to accomplish, but just launches into, what you need to have is this particular operation. Well, first of all, this is cosmetic surgery. You don't need to have anything. But if you're interested in some type of improvement, the surgeon needs to have a real good, well-formed idea of what it is that you're trying to accomplish, not what he's trying to accomplish. So if he doesn't listen well to you, that's a red flag. And along those same lines, again, if you identify what you want to have done, yet he or she says, well, that's fine, but here's what I think you ought to have done, and doesn't explain why they want to change the plan, you ought to thank them very nicely and leave the office, because that's just not going to work. Another red flag would be, you ask this surgeon, okay, after surgery, post-operatively, if I have a question or a problem, who do I call? And who's going to answer the phone? If, even on a weekend, how about at 11 o'clock at night? Who is it going to be? Is it going to be the surgeon? Or is it going to be some other partner that doesn't know you, doesn't know anything about the procedure itself, really has no connection whatsoever? So, this is something you need to establish. The surgeons who practice in the large multi-specialty groups, this is very, very common. They have their own call schedules and their own call partners, and the person who is going to be taking the call may or may not know anything about you. I know a great deal about this because I used to be in one of these call groups. And other patients would call, surgeons' patients would call me, and I didn't know who they were, what procedure they had, how many days post-op they were. It just made no sense. I take my own calls, 24/7. I always have, and I always will. So if you're having a question or a problem post-operatively, you call my cell phone, the one that's on my hip right here, and you will get me. That's all there is to it. And finally, if you're just talking with the other surgeon and you just get a kind of a funny feeling, you're not connecting with them, that makes no sense. There are a lot of surgeons out here. A lot of surgeons are much better in the operating room than they are in the exam room or in the consult room. So if you just get a sense that your surgeon is not listening to you, is not connecting with you, you're just not getting it. There are a lot of surgeons out there. You don't need to go with someone who you just don't feel comfortable with. So, as I say, these are good tips to use when you have a consult, or a new consult with a patient. You know, there's a little voice in the back of your head, and you got to listen to it. If it's saying, you know, I'm just not sure, there's something wrong here. There's no reason you have to go with the first surgeon who you have a consult with. There are just too many of us out here, and you know, many of us do different procedures differently. Some of us do it better. So check around. All right. Well, that's really what I have to say about selecting a plastic surgeon. The most important part of today is introducing you to our celebrity guest. Dutch, come here. Come over here. Come over here. This is Dutch. Sit. Dutch is part of our family. This is he's about a three and a half year old, obviously a German Shepherd, but we're not sure exactly how old he is or what his pedigree is, because Dutch is a rescue dog. Dutch was found wandering the streets of Milwaukee as we think about a 3-month-old puppy. He was picked up by Milwaukee Animal Control and brought to an animal shelter on the east side of town here, a wonderful place called Shelter from the Storm, by the way. So if you are interested in picking up a rescue animal, that's a great place to do it. But at the time that he was brought in, come over here and sit down. Sit. He was, my son was the assistant director at the animal shelter. So he was trained by my son to be this wonderful comfort dog here. Yes, and at the time, our family was between dogs. We had just lost our second lab, and we were dogless for the first time in a couple of decades. And I wasn't sure, since I'm getting on in years, I wasn't sure I wanted to take on another dog. But my son conspired with my wife, and the next thing I know, we've got Dutch. Now, one of the reasons I wasn't sure about Dutch was I was under the misconception that German Shepherds were mean dogs, were aggressive dogs. We always had labs when we had small children in the house, because labs are known to be child-friendly. And you know, in the 30 years I've been a plastic surgeon, I don't think I've ever gone to the emergency room to sew up a dog bite from a Labrador. And since I grew up in the 60s, I used to see newsreels of protest marches, and the police had these aggressive German Shepherd attack dogs trying to keep the crowds at bay. So I thought German Shepherds were you know, aggressive, mean, and dangerous dogs. Well, okay, Dutch, come over here. Show them. Sit. This is the sweetest, most gentle animal in the world. All he wants to do is make friends with everybody. He doesn't have a mean bone in his body. He is just as sweet as can be. The most difficult thing with him is he will go out and sit at the end of the driveway and wait for any delivery trucks or mail truck to come. And sometimes the delivery guys wouldn't want to get out of the car because they thought he was a mean dog. No, he just wants to go home with them. But he's just a sweetie. Yes. So he has come to live with us, and you live with us as long as you like, because you are just a sweet. Yes, I know. I love you too. So anyway, well, that's what I've got for you today. We're not going to be broadcasting for the next 2 weeks. We're taking a couple of weeks off, but we will be back in February. So try to keep warm and have a good Super Bowl Sunday, and we will see you then.